welcome to Health Live at Seniors today. We're delighted to have here once again. He's been on our Health Live sessions at least thrice earlier, and we're delighted to have him here once again. Dr. Rajesh Dharia, who is a Senior Orthopaedic Surgeon based in Mumbai, and he's going to be talking about hip replacement for seniors. Before I invite him to speak, I'm going to introduce him. Dr. Dharia is a leading consultant, orthopedic and joint replacement surgeon based in Mumbai, having performed over 10,000 replacement surgeries. An award-winning doctor, Dr. Dharia is trained in Mumbai, UK, Germany, the US, Japan, and Australia. We have had Dr. Dharia once in the past on replacement, and we have requested him to speak once again about hip replacement. But before I get him to speak about hip replacement, let me give you the genesis of how we got on to inviting him to speak about it. We speak to our doctors often and figure what they are up to and the various progresses they're making. And he told us about hip replacement surgery that he did with a very well-known person in the entertainment world, Tanaz Irani. And when he told me about her, and I, of course, am familiar with her work, he mentioned that he did a hip replacement surgery, and immediately after that, the lady is back on her feet, shaking a leg, literally. And I'm not very sure how safe it is to do that, but she is doing that, and he's obviously aware of that. And so what I'm going to do is I'm going to request our team to play a few videos. So this is Ethiopian grandma with slept with the leg in the air for 5 years. And this is Tanaz Karim. She is Tanaz Irani. She she has with a walking stick, she was moving around, and now she is on her road to recovery, and she is shaking a leg, if I might say. And she is as we know, very well known for her popular TV shows with dance and reality shows. And so it's good to see. Then there is a 100-year-old who gets a broken hip repaired, and that is on a rings in her birthday, and that Dr. Dharia was associated with. And what else? Do we have a video as well?
माना कि मुश्किल है सफर पर सुनो मुसाफिर Starting now, there's no road left for wandering. Got a new vision of yourself, and she's who you wanna be now.
Great, super. Thank you very much, Dr. Dharia. Congratulations, you've done some magnificent work. Is it a magical work, or is it something that is a known thing in the orthopedic world today, where people can walk immediately after surgery, they can even shake a leg, etc. Is that a done thing, or is it something unique?
Well, Mr. Pradyuman, first of all, thank you for the introduction. And as you said, this is the second time that I'm coming on your show. And that is, earlier I spoke more about the knees, and this time will be more about the hips. The second thing is, you asked me whether it is a very regular phenomenon in our medical world. So if you ask most orthopedic surgeons, even them will not be able to point out which hip is operated after a brilliant result like this. I have also told Tanaz not to really be dancing and doing awkward things, but she's somebody, she's a marvelous person, and she's a very positive person, and she always goes by the fact, by the hopes that nothing is going to go wrong. Like, she's a hardcore believer in positive things. So whenever I tell her, she says, doctor, nothing's going to happen now. That's how she is. So let's hope and pray that it'll all continue with her and she won't have any adverse events. Another thing is that, you pointed out a few articles. So if I may go back to the first article that you showed about the Ethiopian grandmom, what I want to,
Can we just do that, Feroz? Can we
yeah.
play the first article?
Now, if you zoom into this article in the third column, if you zoom in the third column, you know, yeah, if you go up a little bit. So here, if you see the patient's son, if you see, he says clearly that I had taken my mother to USA and UK also, but she was not helped. So, when such a thing is encountered by some patients, I really feel glad that we in India can do much better work. And the world recognizes Indian doctors to be better, than most of the doctors all over the world. So, this lady had a very bad hip, and the hip she wasn't able to straighten her hip. It was bent to 90 degrees, and she was in the wheelchair all the time. And fortunately, now India is and especially Bombay has been established as a medical tourism place, and people from the world, they travel, and I was able to offer her a fantastic result. So as immediately after I did the surgery, she was able to stand up, she was no longer on the wheelchair. So next day we could make, the hip was so bad, and I did it by a special approach, and we were able to make her stand, and she went home very happily. And this was a very, most of the surgeries that I do are very job satisfying for me because I can render an excellent result. So that is the most, that is, and after some stage, this is what is important for us doctors. If you see the other article where it shows that a 102-year-old was operated, if you can please go back to it. And if you zoom onto it, yeah, if you see this article, I performed this surgery at Saifee Hospital. So this guy, he was 102, and the entire family was totally against any form of surgery. And 102 years old, obviously, our Indian mentality is such that even beyond 75, 80, people are very reluctant to undergo any surgery. So 102, he asked me, doctor, what is the guarantee that he will be all right? So I didn't have any answers for such patients. But fortunately, and most of the times, these hip surgeries, hip fracture, they are mandatory surgeries. One has to perform the hip replacement at this age or any age, so that they can sit up and they can do their regular basic activities. And this guy, he stood up and he walked out of the hospital very happily. And I was extremely happy to deliver such good results. I mean, some of these get into the media, some of them don't. I have also done 110 and I've done 114 also. Some of them get onto the media, some of them don't. But the idea is that whenever these patients, they do come, it is mandatory that surgery should be done. So many times there are patients who come to me and ask me, doctor, is it a good age to perform surgery? Or, even some people are 70, they say, Abhi 70, what is the point in operating at this age? So I'm telling you once again that these are not one. I've got many other newspaper articles wherein I've operated on 80, 90, 100. So it is important that we have a clear mindset now that surgery is an alternative for the elderly. And if you don't do it, this could lead to a lot of issues in their entire life, and you might end their life early if you don't do the surgery. I agreed that at 102, nobody can give any guarantee. But these they work really well. Most of the times they work well. So that's how it is. As far as Tanaz, what you showed, Tanaz is a very entertaining, enterprising person. And she had this long lasting problem in her hip, and she was not diagnosed for a long period of time, almost 2 years. If you watch her Instagram or YouTube or lots of other media that she has, delivered over the last few years, you can see that she was in really, real pain, and then she tried to train herself into ignoring the pain and all that, but finally it was God's wish, so she landed up with me, and I could tell her that the problem is in the hip. And when we saw her x-rays, she had a very bad avascular necrosis of the hip, and the hip was totally destroyed and very bad arthritis and all, and we had to replace that hip. And touch wood, she did exceedingly well. Immediately after the surgery, she was able to stand up. Earlier, her leg was shortened. So for the first 2 3 months, she had a bad feeling that, my God, my leg is lengthened. So how am I going to walk and all that? But she was walking nicely. Slowly, slowly, now she is, as you can see in the videos, that she is walking. She's walking without, no limp. And, you can't make out that she's had a surgery, to the extent that she's even able to dance. This is quite an amazing. I mean, most of my patients have such good results, but for a celebrity, somebody who's in the eyes of the camera at all times, it becomes very important for somebody like me to deliver that kind of a result, because otherwise, she won't be, any leading person who's in the eyes of the media won't be happy, if there is something which is seen, if she has a limp or something like that. I warned her that please don't do all this dancing so that your hip will last a little longer. But then let's hope for the best.
Doctor, tell me this, obviously is this fraught with some danger, because as you said, you alerted her that please don't do it. Um, what is the likelihood of success? Because if you have, after the hip replacement surgery, you start straining your hip, uh, is there some damage that could be caused later?
Yeah, I mean, basically, yes. See, what happens is, in her case, or many other young patients, they are very highly active. They are very highly active and their demands are very high. Because so we always tell the patient that if you want to have a hip replacement surgery, then the first no-nos are that you won't be able to bend beyond 90 degrees. You won't be able to sit on the floor. You can't really be jumping around. Your hip won't take those thrusts. You can't be rotating your hip at any angles or something, or you can't be sitting cross-legged. All these things, if you do, then there could be a danger of the hip getting loose. Hip might get loose, or there could be some other issues, the liner can break and all this. So one has to be very, means you can lead a normal life, but you can't lead an athletic life with the replacement surgeries as far as possible. If you wanted a prolonged prosthetic, without any issues, then it is better to have a little constrained activities. That is the usual norm.
Right, right. So, so what you're saying is that 9 out of 10 times things are okay.
Things are okay in the sense that people do listen to us and they don't go beyond the advice. That if I have told them that don't run around or don't jump and dance and all that, they don't do it, you see. They don't do extremes of activity after hip replacements and all that. So they always, but then we also get these high demand patients who are like, hyperactive, who are very young. Usually the hip replacement done is a little elderly people, you know. So some of these are elderly people will obviously be low in activity and they won't have much demands, So they are okay. But it is these young patients when we get, that is the time when it is a test of the metal, you see. You have to make sure that it gives an excellent result. You don't have any limp. You can do most of your activities without any problem. That is what is important.
Right, doctor, what is the the cemented and cementless hip replacement? What is the the success rate of both?
Yeah, so see what happens is that in young patients, almost and nowadays when the bone quality is good in a patient, then it is better to do a cementless hip. You see, only in the much elderly group where the bone quality is very poor, it is very osteoporotic. And if we use a cementless, then it will become loose very fast. So it is in the much elderly patients, or if we are doing a hemi replacement when there is a fracture in the elderly, like an 80 or a 90-year-old, we always make it cemented. So then the processes will not move inside, because an uncemented process which we put like in the young patients, it will take time to get cemented. It will to not cemented. I mean, it will take time to get incorporated into the bone. So for that much time, the patient really has to be careful and make sure that there is incorporation of the prosthesis inside the bone. So the bone quality also has to be good. So the selection of cemented and cementless is important. In the earlier days, when John Charnley in 61, when he, in those days when he started doing this hip replacement and low friction, that time it was only cemented. So even for young patients, he used to do cemented hips only. But it is a recent, like over the period of years, he never thought that if there is a problem, how he will remove. So over the period of years, after having 20 years, 25 years of hip, or after failing, and the hip became loose, everybody found out that it is a hell of a problem to remove all those cement which is from inside that bony canal and then replacing it with another prosthesis. So people felt that it is better that you do uncemented hips. So if there's any failure, we can remove that hip and then put another hip.
So
So that is,
similar with metal versus plastic, and ceramic, it's
yeah.
the same theory which pertains to that.
Now, this what you're talking on metal and ceramic and plastic, that is the coefficient of friction. So the wear. So what happens is that after putting plastic, the wear rate is say 0.15 per year, per year. Whereas in ceramic, the wear rate is 0.002 per year. So the wear, I mean, the wear and tear as we are performing regular activities, there is wear at the liner. So if the wear out is fast, then we'll have to revise it faster. So in young patients, and those who are affording, we always prefer to put ceramic because the wear rate is very low. Only thing is ceramic is a little expensive. It's
So
not
what is the cost involved?
the ceramic. If you put the ceramic both sides, ceramic metal and head and ceramic liner, then the difference is it goes to 50, 70, 80,000, a little more sometimes. Okay, but if you are using metal on plastic, then it can be a little cheaper. And again, the cemented ones are much cheaper. The cementless ones are a little more expensive. That is how it is.
So what is the basic cost? As in, you mentioned about the increase, but
What happens is that in India, we have a plethora of companies wherein there are imported companies like, and then we have Indian companies also now which are manufacturing these joints. So these local made prostheses which are there, sometimes there could be failures of loading, unloading. So nowadays, what I feel logically is that patients who are like 85, 90, or very old patients, where we know that the activity level is not going to be there very high, we can safely use the Indian implants because we are not expecting them to last for 15, 20 years, something like that. But younger patients, who are little less, and we expect them to live longer and the process to perform, or if the patient is affluent and they want the best, then obviously we go for the imported implants, which are a little more dearer than the locally made implants. That is how we do. And as far as possible, I always go for the imported ones because they have a little bit more standardized protocols in their manufacturing.
and are these covered by insurance?
Yeah, they are all covered by insurance. All the processes are covered by insurance. There is no problem at all. It goes in the heading of medical materials. So the total amount is done by the insurance company. So it is perfectly fine. As far as the hip, if you are using a ceramic, yes. The problem is that only like in the knee, there is a lot of standardization where the government has given certain fixed protocol, fixed pricing for the implants for the knee. So for revisions, we are not able to use all that. All the revisions are problem because still the standardization of the amount of funds to be given for these by insurance companies is not done.
Right.
Some of these cases we can have issues.
But overall, the success rate is good.
The success rate of hip of all the replacements is very good actually. For the knee, it is almost 96 without robots. And now with the robotic companies selling and they are trying to say that we might get it more, it is not possible. But the robots are selling in a big way. I mean, majority of my patients, because I've been doing it for so many years now, they have been done without robots. And now with the advent of robots, if the patient really wants a robot to be involved, yes, then we do involve the robots. So that is how we do it.
Right. Do we have any questions from the audience?
Yeah, but most of the things I think you have asked me very pertinent questions about hip replacement surgery. And most of the time, the recovery in the hip replacement takes a little longer than the knee replacement surgeries. So sometimes, what happens is that there are certain marketing videos which are put up by some younger orthopedic surgeons or somebody, I do not wish to. And then the patient gets misled that, oh, I have to be running from the next day and all. That does not happen. So it takes a due course of time and it is also based on the patient's agility pre-op. The patient's, whether the patient is young or old, and the patient's general condition of the patient. All these things are very important.
There was a
And
question which has been asked about what are the indicators that I might need a hip replacement.
yeah, so now the indicators are that you have severe pain in the hip. You're not able to walk a good distance. You're not able to sit down. While sitting and standing also gives you a lot of pain. And if you take X-ray, it will show arthritis. Or what has happened is that post-COVID, during COVID, there were a lot of high degree of steroids that were given. Now, this can happen even if you have a skin condition and you're applying a lot of steroids, or there could be alcoholic avascular necrosis. There are people who are drinking high amount of alcohol, then they could give rise to avascular necrosis of the hip and arthritis. Then there are sickle cell anemia some people have. Some people have this Cason disease, they have this dysbiarism and all. Or some people have developmental dysplasia of the hip from childhood they have something. So because of all this, if there is a wear and tear in the ball of the hip and it is symptomatic, wherein there is a lot of pain and other things, then obviously you need to approach your doctor, get an X-ray done, if necessary, get a CT or an MRI done, and then discuss with the doctor, and if required, do the hip replacement, and we can give you excellent results. Many times the problem is that the pain is referred in the back and the hip gets confused with the back pain and they go to the spine and then they get into a different track only totally. Sometimes the hip pain is referred to the knee and the pain problem is in the hip, it gets totally diverted to the knee. So I warn the patient against sitting in the wrong train or the wrong bus because you will lead to a wrong destination.
Right. Right.
Yeah, and Tanaz actually was she's a very good example because first 2 years or more than 2.5 years, she was told that all the problems are because of the back. And she did all physiotherapy and she did so many other things, you see, without knowing what her problem is.
Amazing. Doctor, thank you very much for a very detailed presentation. And I think although it's been short, but it's been very thorough. And as always, I'm really glad that you could come in for this session and reply to all the queries. This video will be up on the Seniors Today website on Monday, and along with the takeaways that will also be there. So please watch it, and the takeaways also will be there as an article on Monday or Tuesday. So do take a look, and we will be back once again next Saturday for another session of Health Live at Seniors Today. But before you leave, I'm going to play a video of our latest issue of Seniors Today magazine, which is going to be out any minute. We had good fun putting this together, and do take a look at the Seniors Today magazine on our website. It's free of cost, free to access. So do take a look. Thank you very much. Thank you once again, Dr. Rajesh Dharia, for being here. And thank you to all of you. We will be back again next Saturday at 5 p.m. Thank you.
Thank you. Thank you, Mr. Pradyuman, for having me over. And I hope most of the queries would be answered.
Yeah, they were. Thank you.
Thank you.
Subscribe now and press the bell icon. Never miss an update.